Hi, good morning Rolls. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 8th of June 2021. How are you doing?
Hi, good morning Mihiraa. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Rolls Langer.
And what is your candidate number, please?
My candidate number is 232791125.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you do when entering a patient's room?
First, I knock to let the patient know I'm at the door. Initially, I'd introduce myself and try to find something in common with the patient so we can get to know each other. I always greet the patient and ask if they need anything, even if they aren't capable of responding.
How do you handle ethical or philosophical differences with a patient?
When I feel judgment or disapproval welling up inside me, I do a quick mental inventory and check-in. It doesn't happen often, but I would not be human if I said it never has or will again. I don't know why the person made the choices they made, or what led up to it. I only know that my job is to help them, and I stay focused on that. I've worked with drug addicts and criminals, but my job is to be kind, provide excellent care, and maybe even learn something from them.
How would you handle it if a patient refused care?
If a patient refuses care, I'd find out why. I'd take the time to talk to them, to make sure they realize I'm here to help them, and that I only want what's best for them. I've found that treating people with respect and dignity goes a long way in earning trust. Once they trust you, they will listen to you.
Can you think of an experience in which a patient's care was considerably different because of your close monitoring?
I was assisting with surgery and noticed some irregular heart rhythms on the monitor. Due to my preoperative care and communication with the patient, I knew that the patient had heart issues in his history, and that it was important to take care of the issue right away. I administered medication to help regulate it, and the rest of the surgery went along without any problems.
Talk about a time when you handled a high-stress situation calmly and effectively.
I was working a shift during which we were short-staffed and had a high volume of scheduled surgeries. I had to assist with multiple surgeries at the same time, which was very stressful. I kept an open line of communication, going with the doctors, and focused on staying detail-oriented, and focused on each surgery at hand. It was a long day, but everything went smoothly.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start the OET-speaking roleplay. Don't worry if I stop you when the time is up.
Good morning. I am Rolls Langer, one of the nurses working in this clinic. How may I help you today?
Good morning, Rolls. My son was recently diagnosed with asthma and I have some questions about his medication.
Sure, I can help you. May I know your son's name and age, please?
His name is Milan and he is 6 years old.
All right, how may I address you?
You can call me Mihiraa.
For better understanding, can you tell me more about Milan's asthma?
Even after starting the treatment, his asthma doesn't seem to have improved. He's been using his reliever inhaler, but I am worried, because he has had to use it almost every day, during the past week.
I do really understand your concern. By the way, Mihiraa, I would like to know your understanding of different types of inhalers.
Oh, I really do not know much about inhalers.
It's okay, Mihiraa. I will give details of the inhaler.
That will be of great help, nurse.
Mainly, there are two types of inhalers. One is preventer inhalers. It is prophylactic, which helps in preventing the inflammation of the airways. Preventer inhalers need to be used regularly.
All right.
The second type is a reliever inhaler, which is prescribed for your son. A reliever inhaler is reactive, and its function is to reduce inflammation or swelling in the airways. The reliever inhaler is used only when required.
Okay, I got it. And I hope there aren't any side effects from using another inhaler. Isn't it?
Mihiraa, your thoughts are pretty natural. There will be some side effects while inhaling preventer medication or corticosteroids. The good news is, these side effects can be avoided with a good inhaler technique, as well as by using a spacer. Yes, to avoid the risk of side effects, ensure the use of low drug doses, alongside the use of a spacer, while inhaling to prevent complications.
Oh, I see.
Mihiraa, an inhaler works most effectively when it delivers a medication in a slow and controlled way. Adding a spacer to an inhaler can help. Spacers are especially useful for children who may otherwise have difficulty using an inhaler.
Yes, I understand that.
Mihiraa, let me outline the benefits of a preventer inhaler. The first and foremost thing is that the preventer inhaler develops long-term protection. For optimum results, I can advise on the frequency of use of preventer inhalers. It needs to be used twice daily, that is, morning and evening. I hope it is now clear to you. May I know, do you have any other questions?
It's fine. I will get my son a preventer inhaler to use. Yes, nurse, I have a query. My son loves playing sports, and I hope exercise won't cause him to have an asthma attack.
It's good to hear that your son loves sports. Actually, Mihiraa, it is good for his health. Let's discuss the importance of your child living a normal life.
Sure, why not?
It is very important that children should stay active. Being active can make children remain healthy. In addition, if he encountered asthma during activities, it is appropriate to use a reliever inhaler. As we already discussed, the reliever inhaler is reactive, and its function is to reduce the swelling in the airways. The reliever inhaler is used only when required.
Yes, I understand that.
Mihiraa, I suggest another review for your son, to check on the progress he has. For the review, your son needs to be present. It will be in 6 weeks.
Definitely, I will make an appointment for him in 6 weeks.
That's perfect. Mihiraa, always feel free to ask your concerns. I wish your son a healthy life.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.